Patient comes for a consultation for blepharoplasty. Most patients for the upper bleph, they complain about hooding or excess skin. What does that mean and how do we evaluate the patient? Well, the first thing that we would like to ask the patient is what really bothers them. Is it the extra skin, just covering the eyelashes? Does it affect their vision? Have they ever had any tests that affects the visual fields, for example? There are people that have so much extra skin that it affects the visual fields on the sides and they can't see to the sides. Also, we ask about dry eyes because it is important. People with dry eyes tend to have very sensitive eyes, and the blepharoplasty procedure can worsen that dry eye symptom. When we examine, we evaluate a few things. One is the position of the eyebrow, because that's important, because the eyebrow and the upper eyelid, you can consider them as one unit. If there is ptosis or droopiness of the eyebrow, we evaluate, does the patient need a brow lift in addition to the blepharoplasty? Is the main problem the brow itself, the position of the brow? Can it be corrected with injecting some fat, typically in this area, to add some volume to that area to raise the brow up a little bit? Then we evaluate the lid. We evaluate how much extra skin there is, the laxity, the position of the lid margin compared to the pupil and the iris. And we look at the conjunctiva and we evaluate the position of the globe itself. The eye itself, is it negative, positive, or neutral? The position of the eye globe itself does affect the overall result. It is important to stress that when you remove the skin, we remove enough skin to give the patient the visual impact they're looking for, to give it a fresher look, but also to allow the eyelid to close specifically at night. If we remove too much skin and there's so much tension on the eyelid and the patient can't close their eyes at night, then they develop worsening symptoms of dry eyes because they can't close it and protect their cornea. The second thing is the lower eyelids. We evaluate the bagginess. Is there projection of the fat pads into the eyelid? Is there a problem with the laxity of the eyelid? We sometimes pull on the eyelid to see how lax it is. Does it need to be strengthened or tightened on the side? The tear film, and obviously the junction between the eyelid and the cheek margin. All these we take into consideration to try and rejuvenate this area. So the eyelid procedure is just not removing skin and removing fat, but we look at the whole picture, the whole arc, if you might want to call it, around the eye and evaluate extra skin, need for volume with fat typically. The fat is usually obtained from the abdomen or the inner thighs and made into smaller particles, we call them nanofat or microfat, to add to our procedure so we can rejuvenate the whole area. Have a great day.